questions about gynecology or gynecological changes. It is probably one of the most popular topics. In an increasing number of cases are diagnosed here various cancers and consequently invasive therapy, often hormonal. What is worse, more and more people fears completely unjustified all kinds of gynecological symptoms, or afraid of the same diagnosis. Let's talk in short. The most common changes that may occur in women: on the ovaries, muscles of the uterus, cervix, vaginal epithelium or epithelium of the clitoris. Lately I observed that gynecological change which we fear most, it is so-called cervical cancer. Cancer of the cervix is in fact an inflammatory epithelial tissue of the cervix. So what is diagnosed as cancer is actually nothing but inflammation appearing during the period of recovery from previously existing there ulcers. And indeed, during the period of recovery from the disease there is also bleeding. And someone can be very scared. In addition, if a person has blood disorders, except that she is going through inflammation, this person will be also strongly bleeding. That's why it is therefore important that we understand these processes and unnecessarily not fear, not invoke more symptoms from those that there are, and those that are acted wisely, that we did what we really should for the sake of regeneration and complete recovery. Epithelial tissue of the cervix responds to conflicts related to woman's sex, who might call the sexual problems. However, these are not the only problems directly related to sexuality or sexual act, but with the frustration appearing in a relationship while being together. Of course, the community of man and woman is a sexual relationship. And therefore I emphasize that it is not just about sexual problems. How about frustration resulting from being together? The problem may be a lack of relationship or disinclination to it. This includes also rape, betrayal, humiliation. Sometimes a woman gets frustrated wondering, am I want to be with this man or not? If I need him, it's him I planned my life. But now he is no longer needed. And immediately the conflict starts. Another disgusting thing, I'm sorry but I cannot use another word because until I got sick when I talk about it, is that now young people, children, school children knowingly and intentionally expose themselves to sexual conflicts, most often due to carcinoma of the cervix. In his youth, even as children 10, 11 and olds, have inculcated false, untrue and false beliefs such as, careful but do not catch HPV because HPV is contagious. I don't mind that now you have not maybe your boyfriend and it is a carrier. If it has happened to you, go to bed, then you can catch him, you will get cervical cancer and die. This tale and the scare cause a huge shock in young people. Imagine a man at the age of 10 years experiencing his first love, begins to sigh, my God, she's the only one, how wonderful it would be to hug her. Even I would have an opportunity, but I do not dare because even I catch HPV. Conflict ready. The child will begin to suffer from the conflict, which will result in undetectable and appear completely unconsciously ulceration of the cervix, that in the active period does not give noticeable symptoms, because here in the active period the sense of the formation changes appears. They are not intended to interfere with fertilization or leading a man to lose well-being. There is no any symptoms. If the woman in this case undergoes a gynecological examination, the doctor diagnoses ulcers in her cervix or more colloquially erosion of the cervix. But it does not hurt no bleeding, nothing happens. It just means the active period. When the conflict is over, let's assume that young biology wins. Mother Nature made it up that they were together and there was good Amicia there. But I didn't get infected, the girl calms. Months of stress and frustration caused by the uncertainty of contracting HPV or not. Replace the peace and well-being. And now please, as if from the office, you develop symptoms of cervical cancer. Where once again I emphasize, cervical cancer is nothing but an ordinary, not dangerous, not harmful, not risky inflammation of the cervical epithelium. You can't die from it, and everyone should know it. Any advertising campaigns appears to scare women these symptoms, and force it to use all available products and services, because no one has died yet from cervical cancer. After all, it does not cause cardiac arrhythmias or disorders of the brain. It is not mortal. Thus cervical cancer may cause discomfort and can result in bleeding. In the period of recovery from the disease, epithelial tissue swells, giving signs of inflammation. It becomes hypersensitive, itches, hurts, stings, which can be very uncomfortable. But this is not mortal. It is like herpes ordinary, with this difference that on the neck of the uterus, and like herpes on the lips, is not mortal, the same this one is not. In contrast, the conflicts caused by the diagnosis can induce further changes which easily lead to complications. Due to you can really die. However, this particular symptom, this particular change in itself is not mortal. Thus cervical cancer is the ordinary inflammation of the cervix, which occurs as a symptom of recovery from the disease. So when we see it, there is no longer a problem to be solved because the conflict occurred before symptoms appeared. The conflict associated with frustration because of problems in being together, a community of male and female sexual or partners. The second most common gynecological problem arousing fear among women is so-called ovarian cancer. Let's see what the ovary. It is constructed from ovary tissue specialized in the synthesis of hormones. So this is a special tissue providing the optimal environment for the storage of oocytes, protecting them from the moment of our conception until death. And in addition, it synthesizes the hormones necessary for the life of the woman. They are essential for life because without these hormones a woman cannot become pregnant or give birth to a child. If someone goes conflict associated with self-esteem, which we call the conflict of loss of a relative or loved one. Someone's beloved relative dies, father, mother, siblings, uncle or aunt. Anyone from relatives. Then the man is shocked, turns out that he cannot imagine life without that person. He thinks he lost part of themselves. That without this person he is no longer good enough, he cannot cope. That without this person cannot continue his life. He wonders what happened to him to happen now. I feel very lost. In connection with the loss of a beloved relative, your brain feels the need to make up for the loss risen, replacing a relative who passed away. So this kind of drop in self-esteem, feelings of sadness, grief and lack of humor cause depletion of ovarian tissue. The outer portion of ovarian begin to be noticeable small tissue loss. For example, if this condition persists for 2-3 years, which is very rare, 1 up to 2 cases per 1,000, then the size of the ovary can significantly reduce. Then you are diagnosed ovarian atrophy or necrosis. In a normal case, and thus the majority of women, holes are formed in the ovarian tissue, disappears, resulting in the reduction in the amount of hormones produced by it. A woman loses her femininity, male hormones begin to outweigh a little bit, she begins to behave like a man. This applies to her feelings and psyche. And due to the decrease in the level of female hormones, the libido lowers, it ceases to desire sex, will not feel excited by the presence of man, will seem lukewarm. However, should remember that a symptom caused by atrophy and consequently a decrease in hormone levels is not a mental problem. So if hormone production returns to normal, a woman regain her femininity. So in the active period, conflict comes to atrophy, unnoticed tissue defect, and decline in hormone levels at the same time. There may be signs of a decline in hormone levels are already noticeable. However, women do not pay any attention, downplays the problem of decreased libido, saying that the lack of desire of weeks, it's nothing, it's a normal thing. They do not realize that there may be a problem with the organ. When the self-esteem of women back to normal after the loss of a relative, a family member, friend or animal which is considered a family member, when period of mourning just end up, when it ceases to feel inferior because of the loss of a loved one or creatures that may be a cat, dog or even a mouse. If she really loved her and she lived with her, begins associated with inflammation filling cavities of ovarian tissue. The area covered by the disappearance is filled with a thin layer of fluid, the cyst is formed. There may be created so-called interstitial cystitis, interstitial or cyst, which is inside the tissue of the ovary, or may arise over the protruding tissue, cyst ovarian, which locates in the space of the abdominal cavity. What it is really interesting and what formerly was completely misinterpreted, leading to a huge panic and fear among the people. The fact that the cyst, which eventually becomes a tissue, complementary cavities of the ovary from the beginning, does not contain the necessary blood vessels providing blood flow. The cyst needs 9 months to harden, which technically is called induration. And by this time, interestingly, exactly the same time how long it takes multiple cysts is needed unborn child to have matured and could be born. So for a period of 9 months the cyst attaches itself to the environment, securing this way the flow of blood and nutrients. In the past people did not know what it is, only seen infiltrating growths to adhere to the environment. This is the cyst which previously was not there. People were afraid that this is something grows and starts eating its surroundings. They did not take into consideration that if they do not move cysts for 9 months, that at the end of the 9th month automatically detach and begin to operate as an independent tissue. It starts to fulfill as mesodermal tissue, function of tissue which was founded. A person with whom ovarian cyst had time to harden, because she did not take pain seriously. She wasn't diagnosed and not checked why hurt her back. She just waited and her symptoms are gone. In that person, hardened cysts begin to produce an additional amount of hormones, making a woman becomes more feminine and more fertile than average. How is it possible to argue that such a woman is more fertile than average? As is well known, marketing great works here. That polycystic ovaries is one of the reasons for infertility. This is not a paradox. Now imagine that formed the ovarian tissue, whose task is to make the woman was fertile. She had frequent and efficient ovulation to be more feminine. And what about an infertility? It is very easy. Women who, despite having polycystic ovary syndrome, are able to be infertile. A person who either remain or get into conflict because of reduced reduced sense of its value in relation to their femininity. I was infertile. After all the time, ovarian atrophy reduces the amount of hormones produced, so it may appear infertility. I was infertility. I'm not a real woman. I cannot have children. I cannot give birth. This lowering of self-esteem causes further ovarian atrophy. In vain, and this woman has ovarian cysts. Once again she falls into the active period of low self-esteem, resulting in reduced production of hormones, and infertility. In this way it becomes possible for a woman, in spite of having polycystic ovary syndrome symptoms, occurred infertility. You do not need to believe in what I say. However, please check the following. When a woman comes back, her self-esteem, regardless of the amount held, ovarian cysts begin to menstruate again, and again become fertile. What's more, it will be even more fertile than ever before. It is the cause of ovarian cysts. Malignant ovarian cancer is nothing like a period of growth and hardening cysts. As previously did not know what was happening. Cell proliferation diagnosed with no relation to the preceding it atrophy of tissue were considered as two completely separable issues, even though they perfectly fit together. In this way everything becomes clear. We cease to be afraid of ovarian cancer. I would like to point out that it is not about that, not to take it seriously. However, a person should not generate an unnecessary fear, only to realize at which point of the process he is located, what to expect, and what not going to happen, and further lead a normal life. Please plan your child. Used to say then. Thus changes in the ovaries are caused by a decrease in self-esteem on femininity, or underlying its foundations, sense of loss after a close relative. My value has fallen because there is no longer this important person for me. So briefly presents the biological origins of cancer or ovarian cysts. In today's world, fear in women also cause the so-called fibroids. Firstly, it is clear that fibroid is any thickening and growth of each muscle, smooth muscle in our body, even those forming the walls of blood vessels. Where do they? On the wall of the uterus. The walls of the uterus are almost entirely, excluding the cervix, built from striated muscle, and lining the uterus epithelial tissue, constructed of smooth muscle tissue. Keep in mind that smooth muscle we cannot consciously control. They have separate brain center management and nutrition. Smooth muscle function almost automatically. If a woman comes to the conflict over the lack of kids, I cannot have a child though I'd love to. If a woman misses having a baby, and it is not only her own child but also the grandest my child is already 30, 40 years and I still do not have a grandest I'll be quite old before I will have grandchildren. I would like to have grandson, but I cannot yet be because my children do not get married. Another thing that does not have the grandchildren, but the woman is worried about this. Then even grandma can be contracted fibroids due to lack of child in her children. When fibroids, in any case we are dealing with the conflict against the lack of offspring. I cannot carrying baby keep the pregnancy birth. I miscarried, I am infertile, I cannot feel the baby in my womb. I cannot get pregnant or give birth someone the child. This is the conflict that causes fibroids. Fibroids are an interesting change because they do not cause any complications, especially because the uterine wall inflammation is not allowed. Assume that a woman really misses for his offspring. My God, I have 30, 35, I really want to have a child and still I cannot and I cannot. Seeing in the street child or a mother with a child, even she gets spasms. She so much wanted a child but for some time failed. Let's assume that this state persists for several months. During this time, due to psychological stress in women, there is a smooth muscle contraction, which leads to the formation of spherical shape. Therefore, on the cross-section of uterine fibroids, you can see round spherical convex smooth muscle tumors, which thus grow, taking the form of a sphere. Thus the fibroid is a thickening of muscle tissue of the uterus. Up to 4-5 centimeters in diameter does not cause any problems. You can freely give birth with the size of the fibroid. Let's assume that a woman found at last a life partner. She is happy, financially secure. She feels good with partner. They love each other and waiting for the baby. In the end, the child comes into the world, so the conflict disappears. The woman no longer has to worry the lack of a child. And what happens? Muscles does not decompose. Muscles as a smooth muscle tissue. There is no inflammation. Inflammation would amount to a threat to human life or his offspring. Imagine what would happen if woman enjoying the VIEW pregnancy test caused inflammation of the muscles of the uterus. It totally would prevent whistle-blowing pregnancy. Therefore, the fibroids are not rapidly degraded and instead for many years slowly and gradually decompose. Fibroids can be formed not only in the case of when someone wants to have a baby but cannot, but also in the absence of siblings' offspring. Although I already have 3 beautiful children but my siblings cannot have as much regret it because I know how it is bad because of that. If a woman commits to this condition, persists for weeks, she also will get fibroids. That's how it works. Having someone uterine fibroids shows that either now undergoing active conflict, wants to have a child but it cannot, or was once in a situation that he or someone from his family or from the immediate surroundings could not have children, and this was reflected on his life. I note that fibroids persist for many years without causing perturbation. Of course, here too it may happen that the exception confirms the rule, and someone very extreme will suffer because of the lack of a child. To better understand this, I will cite a concrete example. A good friend turned to me with a problem that she has 20 centimeters, half the size of a fist, fibroids in the uterus wall. To be able to develop fibroid the size, the need for at least 5 years of experiencing active conflict. This means that a woman with a daily frequency, basically a few hours a day, worrying the lack of offspring. Do you guess which profession is practiced by this woman? Yes, she was a babysitter. I imagine that every day she coming to work she thought, I would like so much to have a child, I think I will take one to the house. And as soon as she saw the joy and hear the laughter of children, she immediately felt back pain. She could not have children, first because of financial conditions and later because of a failed relationship. She concerned on a job that was her vocation. Unfortunately, it was the work caused her suffering. She saw the children which she could not have. In this way I emphasize for 5 years, in relation to the duration of continuous sharp conflict, she has 12 centimeters fibroids. It's definitely too much. There are only 2 possibilities: either decides to live with the fibroid, the knowledge that is too large to be able to give birth, so eventually adopt a child, or submit to surgery to remove the fibroid. Unfortunately, there is now in the habit of removing the fibroids, rather removed the entire uterus with the idea that the patient at least will not have more fibroids. So you should deal with the solution of the problem before man crosses the border. Because then, if it does not implement the most modern methods of treatment, it will surely be a result of disability. So before fibroids to produce, a woman can see it. Let's say when a stronger than usual cramps, because the tumor tissue of the uterine muscles, whether the cancer of smooth muscle, the fibroid, there are additional cramps. So the muscle tissue of the uterus from time to time cramps and is able to last for hours even in this state of cramp, the consequence of which a woman may be, for example, menstruation, accompanied by very strong pains. So a woman who doing very painful menstruation, or has with no reason gynecological cramps, and so cramps in the lower abdomen, mild tremors, feeling in the lower abdomen. It should be noted at the time, they are pretty fast symptoms, sometimes already in the first weeks or months. Then the changes are not yet large enough to warrant removal of the uterus or complete removal of the uterus and ovaries. It is absolutely not necessary to end it by this way. If someone will take the effort to learn these rules, because no one will protect against science, new medicine and biology. People do not protect against this. Who wants to experience and understand the functioning of your body, and do not want to accidentally shoot himself in the foot to fall into the trap, or simply too late to convince. He must be learned. He will stop fear. It's that simple. Another versatile buggy on women. It more specifically the so-called endometriosis. There is a problem with the name of the disease. It is in fact the name completely false, untrue and incorrect. Do not indicate the essence of the disease, so it is pointless. It comes from the word endometrium, meaning mucous membrane of the uterus. The end of the cis is in the medical language inflammatory. Therefore endometriosis is inflammation of the lining of the uterus. However, it is understood only occurring in the abdominal bleeding and symptoms of inflammation. Since it is not known exactly how to run these processes, is not known, and more precisely it is not adequately taken into account. The phenomenon of bleeding the lining of the fallopian tubes into the abdomen, because only there is able to put out the liquid formed as a result of inflammation. It flows so on into the abdominal cavity near the ovary, getting this way. How do we know that there is endometriosis? How academics explain its mechanism? Someone discovered that at the stage of embryonic development, so at the stage of development inside the womb, germ cells poorly differentiated, and during the formation of the embryo the cells forming the endometrium end up in the wrong place. They appear in different places and abdomen. They begin to function as the endometrium. The trouble is that as has been described it is not true. Think how often would it happen if it had been accidentally poorly distributed tissue. If so, it should be in that the other person is not it. In addition, it would apply not only endometriosis. So what is endometriosis, since there is an inflammation of the lining of the uterus or wandering lost during the development of the fetal cells attacking us at a later date? Then what is it? Now in the abdomen we have in many places situated glandular tissue, and during the conflicts we are able to combine so-called cells of our body. Let's say that somebody else's inflammation of the lining of the stomach, for example. It occurs when inflammation of the intestines, making his belly is full of fluid. In such cases the body channels formed between tissues constructed from glandular tissue. This is a fistula, no endometriosis. And those channels at an early stage of formation, until they are formed, they are confused with endometriosis. As a defense of this is the fact that both creates the same tissue basics, so you can get it wrong. Not knowing what is what, just watching a section of tissue in a petri dish and analyzing it in terms of morphology, you can inadvertently easy to confuse. It must be understood that what is usually called endometriosis is actually a fistula in the abdomen, whose biological function is the outgoing inflammation cleanse the abdominal cavity from the secretions and other residues. Fistulas occur in typical places, but I do not want to go into it now. Fistulas exist to help in cleaning. Fistulas can be seen in someone who, after problems with internal organs, suffers from the problem of impurities. For example, I feel tainted when my stomach hurts, I'm in the dirt, lies in the hideous cancer which I fear. So that problems with a sense of impurities cause the formation of fistulas. Fistula occurs where the impurity is located. It may occur that fistula will appear not only in the area of internal female sexual organs but in any other place. Among my friends it was a case of a woman with whom fistula appeared next to the navel, in the sense of impurity resulted from practicing belly dancing. She prepared the choreography for the group in the school where she taught. They used her skills and technique to teach the young. However, when it had come to the present, she has been removed. Then again during the preparatory work day and night. But again before submitting, the boss decided that instead of her he gets younger. She felt that it was unfair after all, because she worked at the school she loved to dance and perform. This sense of impurities she moved to the abdomen, thinking that it was the belly dancing has problems, caused the appearance of a fistula at the navel which would fit my finger. Then open the abdominal cavity to get rid of the dirt from the place where she felt it. Thus endometriosis may be associated with problems of female sex. The psychological problem of impurities related to gender and sexuality. A fallopian tube reacts to the indirect sense of impurity. When a woman finds out that in the vicinity of the alcoholic father is harassing his child, beating and humiliating them, the woman is experiencing so much the fact that the child cannot develop normally, that it arises in the fallopian tube epithelial cancer. So therefore cytology is performed. The endometrial epithelium, which occurs both in the inner side of the uterine cavity and in the oviduct. Below the word endometriosis should be understood oviduct epithelial or endometrial, instead of being in different stages of development fistula, which will point consisting of the same basic body. Mucous endometrial membrane responds to the sense of impurities related to sexuality. The conflict between man and woman caused disgust and lust. This may be the fact that a woman's mind is with her husband, her mother talks. Unisex topic here lies in the fact that if a woman feels that her husband is on both the emotional and sexual, this is it very bad influence when his mother hurt him, or when his mother hurting her. This also is for man and woman sexual impurity, because the woman belongs to the man whose mother was in a disgusting way hurts her. This is terribly primitive biology. That the brain in this way marking the conflict launches the corresponding changes in the body. Let's look for a moment that the tissue or morphological changes are accompanied by problems with the mucous membrane of the uterus. When you get a sense of impurity related to areas of male-female or conflict or sexual intercourse, layer of the lining of the uterus thickens. Appears endometrial carcinoma or endometrial cancer. Layer of mucous membrane thickens despite appearing menstruation. This continues until the feeling of uncleanness persists. After the problem is no longer applicable for the newly formed epithelial tissue. Therefore, the body using the present in fungi and bacteria, it is removed and purified. This is precisely what level of symptoms called vaginal fungal white discharge, fungulid structure resembling cottage cheese. It is a symptom of the period of recovery from the disease. It is necessary to realize this, because many women begin to worry when pouring out of them this stuff, accompanied by an unpleasant smell that you cannot stop. And additionally, discharge irritates the inner wall of the vagina. The period of recovery from a disease accompanied by so constant discomfort. Do not forget, however, that the real conflict was preceded by the appearance of symptoms. So white purulent discharge preceded by another problem. You need to check what then worried woman, and try to make this problem or dilemma is not returned. In this way we will avoid recurrence of change. During the occurrence of white purulent vaginal discharge there is no direct conflict unless we mean recurrence of the previous problem. The appearance of white vaginal discharge means that the problem which faced the woman has been resolved. So the woman is in the middle of the road. That is why I say in the middle, because it's not the end of history. There remains an unpleasant part of it. Since the appearance of vaginal discharge is very disturbing women, this may cause another conflict, caused by a sense of disgust smelling secretion that comes out of a woman. The woman feels sick at the sight of her abhors her, which may cause a recurrence of change and thus never get rid of the white vaginal discharge. Another thing to attention is the fact that when a woman who has a discharge is not capable of having sex, we should remember that. Suppose you are a healthy man in whom sexual function are not affected and that in a normal way wants intimacy and sex. A woman who has just vaginal discharge. The woman is worried that being sick she cannot have sex with her man. So there will be a source of further conflicts. As such, honey, I have no sex from 1.5 months, and I do not like it terribly. Warning. These outbursts can again cause changes in a woman and thus does not get rid of it white purulent vaginal discharge. So during vaginal discharge the woman should be left alone. the woman should regularly cleanse her vagina, thereby aiding the process of getting rid of tissue. Do not dispose of a woman allegedly was unable to have sex. I want to talk about it because I am watching that these problems with sex are frequent. While what causes vaginal discharge are long-lasting and can really change the marriage or relationship in hell, it is a continuous conversion problem. This is symptomatic of a situation where a woman is in the sense that because of stinking and ugly disease breaks up her relationship, because she cannot make love with your partner. When one understands this mechanism, will cease to believe that this is impure matter from the point of view of man, or it can cause conflict between man and woman. When the man give it up and look at it from a distance, begin to laugh at the trouble and stop the worry, this will start a period of recovery from the disease and had grown in the course of tissue will be at a similar time decay. This is important because if somebody else for 3 months slowly accumulated thickened layer of tissue, I'm deadly serious. In this person up to 3 months may be vaginal discharge and related ailments. During the period of vaginal discharge, bleeding may also occur. If the endometrium is affected by inflammation, becomes very swollen. You can imagine it as a sponge swollen from the large amount of water. And then during the crisis epileptic complete lateral is bleeding, put out or even about ml of blood or blood secretions. It is very important to not worry about that. It is not about to treat the matter seriously, but not to dramatize because of bleeding. Because even the slightest disgust associated with blood, for example, I sick at the sight of blood, I have had enough of the sight of blood, I hate blood, produces the so-called associated with blood reduction of self-esteem, which is the cause of hemophilia. So not only that worrying of bleeding, it still will cause that it persists. Do not want to go into now in describing the conflicts associated with blood and bleeding. I wish, however, strongly indicate that because of bleeding we should never worry. Instead, pay attention to their cause, treating it as a process of cleansing. The meaning of the existence of inflammation of the lining of the uterus manifested during the active period of the disease. The fact that accumulated and swollen due to inflammation of the mucous membrane on the inner wall of the uterus acts as a magazine secretions arising from primary tissue, until the time when the body starts to get rid of unnecessary longer and backlog in the uterus products. This is why each cycle the entire mucous membrane is eliminated and in its place is increasing again. This is a continuous process which we should not be worried. Sense of appearance change is highlighted in the period of active disease, because more tissue to better its ability to remove pollutants, the ability to create more secretions, consequently improved ability to indirectly deal with the problem of women. For those who would like a better and deeper understanding of the process, since, because of the time that we have gathered only the most important threads and using the keywords I tried to explain them, advised to independently collect information on this topic on page Biologica, which I would recommend. There are materials and courses in new medicine, biology and related topics. And if a person is only interested in specialized information such as symptoms or specific changes, advise view atlas of organs where to find the mucous membrane of the uterus, ovaries, cervix and uterine smooth muscle tissue. On the 4 sides of the collected information, which here in a nutshell is dealt.